Good evening, all participants, and welcome to the new webinar under the medical series from Wolters Kluwer. Our topic today is an overview of medical course and goal settings. Now, this webinar is very important and it provides focuses on the bird's eye view of competency-based medical education as per the NMC guideline 2024. And further goal settings during undergraduate course will be discussed. Our speaker today is Dr. D. Venkatesh, who is a former professor and head department of physiology, professor of medical education, Ramaiah Medical College, Bangalore. With this, we're going to start a session, and I request Dr. Venkatesh to please start the session from his end. Thank you, sir. Please go ahead. Yes, sir. Yes, sir. You can present your screen, sir. Slides.
You can see?
Not yet, sir. I think they are coming up. Yeah, just coming up. So I think they are coming up. Not yet, sir. Just share just click the share button, and then you can have the files ready. Great, sir.
Is it visible?
Visible, sir.
Okay. Good evening, everybody. Welcome to my dear students and my professional colleagues. It gives you an opportunity to interact with you. This is a webinar which is aimed at periodic interaction with the students and also the faculty members. Today, being an introductory seminar, we'll be focusing more on the overview of medical curriculum and briefly about the goal setting, which is an essential component for the success in a professional course. The students have been into medical education for nearly 2 months' time, and they have had an insight to what is being discussed or what will be discussed in the days to come. But nonetheless, I thought it is necessary for them to understand we'll start with the objective for the session. Evaluate the components of curriculum of the past and present, because they have been already talked about the curriculum, the various positives of curriculum, and understand the concept of goal setting and set the goals for self, and then enumerate the attributes of the goal. And goal is something which is set, and you need to plan to achieve the goal. And I'll also give some tips to the planning process to achieve the desired goal. One disclaimer before I start the session. The session is targeted or aimed at first year medical students of 24-25 batch, and it may not be very informative for the faculty who have joined the webinar. And in future, we also want to have regular webinars like this, maybe weekends, so that we'll be able to revise what has been done in the classes in the respective institutions and also give orientation towards the applied aspects and what has not been discussed or what has not been indicated or taught in the first year medical students and the textbooks which are meant to be used by the first year medical students. Now we start with the Columbus School. All of you know who was Columbus. He was an explorer and he set out to explore something. When he set out, he did not know where he was going. When he got there, he went to a piece of land. He did not know where he was. And when he came back, he did not know where he had been. And this is how we start our careers. Unless and until we know our destination and plan towards reaching the destination, we'll also be clueless about what we are doing and how we are progressing. Now, if you look at the present scenario, there are advices which are given to you, and these advices take you nowhere because you'll be in the same place listening to different kinds of people, and each one gives a different direction to reach or the different goal to achieve. Therefore, you need to look at what is your destination and how you plan to achieve that by a very careful planning and setting the goal. Now, at the beginning of the first year, as a student, I described my um, happiness when I got into a medical college and asked my artist to draw, and he drew this picture. I was at the top of the world with anatomy, physiology, and biochemistry carrying me to great heights. But that time nobody advised us to plan or set a goal for ourselves. And we spent our time happily because we had got into a medical college. And at the end of, we had 18 months for the first year, unlike the 12 months which is given for the present day students. So at the end of 18 months, and this was our fate, we were overburdened by anatomy, bogged down by physiology, and we had no clue about what was biochemistry doing. And all of us invariably started asking for help. And this should not be the fate of the students, and therefore this session is planned. Now we look at, I just defined the term curriculum. Of course, this has been defined by your teachers in the foundation course. Just for the sake of completion, I'll define. It's a statement of learning objectives, what you are expected to learn, and your learning experiences, how you are going to learn, either by theory, practice, or the practical sessions. And what is the learning outcome? What is the expected outcome? And it also measures how well you have been able to achieve the learning outcomes. And then it lists the subject matter which is to be studied. Now, there has been a shift in the curriculum design. We had the earlier curriculum which was designed in 1997. 22, 23 years later, there was a radical change or a paradigm shift in the curriculum. And therefore, very briefly, I'll run through what was the curriculum of the past, what is the curriculum of the present, and of course, it is the younger faculty who can say what is the curriculum which is required for future. Though I'll make a mention about it at the end of 2 slides. Now, the curriculum of the past, we had subject-specific learning, and it was compartmentalized. There was a watertight or a rigid compartment into which most of the subjects were fitted, and what you studied in anatomy was not applied in physiology, and what was studied in physiology was not taken to in the biochemistry. Likewise, as you progressed in the medical course, you did not carry what you studied in the first year to the second year. Therefore, it was a standalone learning and a compartmentalized learning, which was very subject specific. The second limitation of the curriculum of the past was it was more generic and there was no integration either vertical or horizontal. We mean horizontal integration is establishing the link between the subjects of a particular phase, and vertical integration is connecting the subjects of the second, third, and first, second, and third phases. Now, the third point, which was grossly lacking in the curriculum of the past, was The affective domain, like the communication skills, the soft skills handling the patient, was learning was learned by students observing the role models. The role models in the earlier years, there were quite a lot of positive role models where the students could imbibe the affective domain, the communication skills, the care of the patient, and they were able to have the patient satisfaction. But of late, it is observed that the number of positive role models have come down, and therefore the level of interaction and, in effect, the patient satisfaction by the interaction of the faculty or the treating doctor has come down drastically. That's a major complaint that we face with the curriculum of the past. The subjects which were studied as basic sciences or the paraclinical subjects were not oriented towards understanding or problem solving the clinical subjects, and therefore the clinical orientation was minimal. Now we have the competency based curriculum, which is in the fifth year of existence. Now they have made a radical shift from the curriculum of the past, where they have tried to reduce subject specific learning and they are trying to promote a coordinated learning. They have tried to make it a comprehensive learning, and they have identified set of skills called as competency, and these competencies are based on what is the desired outcome of a medical graduate. The present day medical graduate aims at treating or managing as a primary care physician at the rural areas. He will not be involved in the tertiary or the secondary care, but the aim of the present day physician is to make him competent as primary physician. So the basic skill sets which are required to function as a primary physician are listed quite exhaustively in this competency based curriculum. And there is a greater emphasis on the vertical, on the horizontal integration. Now, I see the future of curriculum as a modular approach where either a disease or a process is carved out and all the aspects, like if you have tuberculosis, you start with the physiology of the lung, the anatomy of the lung, and then the pathology in case of tuberculosis, the pharmacology, the signs and symptoms management, and if it's an advanced case, the surgical intervention. So you have about 5 to 6 different subjects coming in and teaching one topic of current interest as a module, or it's a modular approach, and that is what we foresee to be the curriculum of future. Now, as I said, there is a decline in the satisfaction of the patients, and there is also an altered approach of the attending practitioners to the patients. The communication has been compromised. The satisfaction in terms of treating the patient or the patient being treated is not reaching the optimum level. There has been an effort to introduce attitude and communication module where the affective domain or the communication skills and the other soft skills are taught with the help of ADCOM modules. The early exposure, and then there has been an effort to improve the clinical orientation in training as well as teaching at all levels. So this is in brief about the curriculum of the past and the curriculum of the present. Now that you have a competency based approach, it gives you greater learning opportunity for you to identify the minimum required competency and then try to train yourself and to be effective in terms of attaining the competency. Now, this competency-based curriculum has listed the specific competencies or skill sets for each of the subjects which is needed for a primary physician. And as you're going through the training in physiology, you would appreciate that there is an opportunity for training. Training is initially, first is the demonstration, second one is training under supervision, and then retraining with the skills, and finally getting the certification for the skill training and independently practicing the skill. So you go through the different phases of training, training under supervision, and then retraining with the skills if you are not competent, and then you get certified for the skill training that you are competent, and then you practice under supervision and then internalize it to practice it independently. Now, one more significant change with the competency based curriculum is there's a sincere effort to align the assessment to measure the desired outcome. If your skills are to be certified and that is to be measured, they have also changed the assessment strategies to measure and certify the desired outcomes. There has been more emphasis on case scenario based question papers, and that gives a clear inclination towards the clinical side, or it gives a clinical orientation. So the present day students have an advantage of specific skill sets being listed, and then there is a comprehensive learning rather than a compartmentalized learning, and there is integration both vertical and horizontal, the assessment which aligns with the measure of desired outcome. So this is about the competency based curriculum. It is often said that if you dream big and you start dreaming, you get up from your sleep, you will be able to achieve it. Now I'll focus or turn my attention towards the goal setting. Goal is what we want to achieve or attain, or goal is an objective or a target that someone is trying to reach or achieve. Now, when you say that you have something to achieve or something to attain, you fix a target. It is not that you fix a target and sleep. You fix the target, get up from your sleep, and start planning to achieve this target. That becomes the essence of goal setting. So, life without goals is like a race without a finish line, and you are running nowhere. And this is the reason why I talked about the Columbus School. In the initial euphoria of getting into a medical profession, we lose our way in terms of planning or setting the goal. When we have not set the right kind of the goal, we are not able to plan effectively, and therefore we will not be able to reach the desired destination. So it is necessary that you understand what is goal, what are the types of goal, and you set the goal and start working towards the goal. Now, having defined the term goal, the goal should have these basic features. It should be a very specific goal, it should be a measurable goal, and it should be attainable, and it should be relevant, and it should be time bound. If I give you an example, at the end of the day, you say, I want to be a prosperous physician. So that is not a goal that you can set for yourself because it's not a very specific goal. It may be your desire or dream that you want to be a very prosperous physician, both in terms of earning as well as reputation. So it has to be a very specific goal, and you should be able to measure it periodically. And if you are measuring periodically the goal, you may fall short of the expectation, and that gives you an opportunity to correct your direction and move towards the goal. Now, it should be attainable. You cannot have a desire which is out of turn or which is not reachable within the stipulated time. So it has to be relevant to the context, and it has to be time bound. You cannot say, I'll pass my first year, but you need to specify that I'll be passing at the end of 12 months. So it has to be time bound, and you clearly say that I'll complete my graduation in 5.5 years and not beyond that. So it has to be time bound, and when you have a time bound goal, you will have the measures or the methods to achieve it. Now, when once you have set the goal, that is the lowest level that you are thinking about, what you need to achieve the goal. You need to plan. You should have a clear plan of reaching the goal, and then you start working towards the goal. Divide the plan into smaller components and periodically check the desired outcome and the expected performance. Say you have a program or a plan that you have made to study for either anatomy, physiology, or biochemistry. Review your plan at the end of the week and find out that what you have been able to achieve. So if you are having the internal assessment in the month of January or the end of January, you should not plan to study anatomy, physiology, biochemistry a week before your proposed date of internal assessment. So you have to make a plan which is workable, and you need to periodically revisit your plan and find out whether your plan is doable, and if it is doable, how far you have been able to reach the desired level of planning. Once you start the work and you have made a plan with a conscious effort to reach the goal, you need to stick to it. You should not become desperate and say, okay, fine, my plan is not working, and therefore I shall not go along with this plan. And then, if you have the 3 steps, make a plan, get to work, and then stick to it, reaching the goal becomes a reality. But setting the goal and not following the 3 steps which are involved in reaching the goal will not take you anywhere. So, this is a word of caution that I want to give you when you start setting the goal. So, you set the goal, start walking towards it with measured steps, you will be able to reach the goal. Now, we classify the goals as short term goal, intermediate term goal, and the long term goals. Now, what is short term goal? I'll take the example of a medical student. A short term goal is something what you can achieve or desire to achieve at the end of 1 year. The intermediate term goal can be what you achieve or what you desire to achieve at the end of 5 years or 5.5 years. The long term goal is something which you can achieve around 10 years. Now, for the time being, of course, I said we will be meeting periodically and we can revisit the goals, and we can also have a comprehensive understanding of the goals and goal related settings. But for the time being, I'll take up the short term goal. The short term goal can be for the first year medical student is to complete the first year with flying colors. So I can set the goal as I'll be the topper to the institution, I'll be the topper to the university, or I'll be the topper to the country. Now we can set the goal depending on the strengths and resources that you have at your command, and then start working towards it. The intermediate goal can be you have to complete the graduation and then work towards getting a postgraduate seat. Now there is a confusion regarding the qualifying examination. All the while you are taking the final year examination, having the internship, and then going in for the postgraduate entrance examination. And in the meantime, during the internship, which is meant for training the students or the student training in the actual profession, it was getting wasted as students started using that internship time for preparing for postgraduate exams. Now, there is a thinking that all the examinations are completed during the final year and they will have a free time to go through the training during the internship, and then they will have the scores which they have got during the final examination to be taken as the qualifying ranking for postgraduate entrance. Still, that concept is not clear, therefore, I will not hazard a guess. So, long term goal can be after your post graduation, you set up your practice and then you start becoming prosperous both in terms of your reputation as well as the resource mobilization or your earning capabilities. So, this is how we can look at the goals. Short term is first year, coming out of first year in flying colors, topping your class, university, or the state or the country. And the intermediate goal is to achieve or complete your graduation and get the postgraduate seat of your choice or your liking. And the long term goal is successfully complete your post graduation and start your earning and then attain some respect and reputation in the field. Now, this will be the short, intermediate, and long term goals. Now, this slide I put because as first year students, you'll be very keen on going through all sorts of information which is available, and then you'll be drowned in the ocean of information, or you may try to acquire wealth of knowledge. Both of us, both of these will not be very useful to you as you have set out a goal for yourself to achieve something in your qualifying examinations. Unless and until your knowledge is translated to the credits on the paper, people will not be able to identify your ability or respect you for your knowledge. Therefore, your focus should be very, very clear. And I understand your first internals are around the corner. In January, probably you'll be having your first internal assessment. Therefore, it is time for you to start preparing. You may have about 3 or 4 internal assessments, which is also called as formative examination, and following which you will have a summative examination or the final examination. So it is rather than getting drowned in ocean of information, it is better to swim in a protected environment and then reach your destination. So my focus will be to achieve the goal, which is the short term goal. And we have tried to put all your survival kit or toolkit in our textbook of physiology. And I'll just give you some tips or the guidance where you need to work on your strengths, strengthen your strengths, and weaken the weakness to reach the desired objective. Now, first of all, you need to look at a sequential understanding and quick recapitulation. You're not alien to this concept where you develop these block diagrams, where you summarize the study topics so that it becomes very handy. This may be available in the books, and of course, we have tried to extensively give it to you in our books. So, you make these block diagrams wherein you are able to analyze after going through the topics. You make these block diagrams, which should be very handy at the time of your examination to revise and also have a comprehensive understanding of the topic that you have studied. It comes in handy for quick recapitulation. Now, the pictures speak 1,000 words. Now, most of the time when we go through the answer sheets, we are really saddened to note that as medical students, you are hesitant to write the diagrams. Now, whenever you want to impress upon your teachers or the examiners, there are a few salient features which are required to be included, like you should have the exhibition of knowledge, and you should also exhibit your ability to develop the answers and then impress upon them with good diagrams, flow charts, and block diagrams. So these are key features which will attract the attention of the teachers, and you will be differentiated from an average student by your ability to impress upon the teacher by giving these value additions. So the most important thing that I suggest to the students is you pick up the line diagrams and practice writing the line diagrams, so you'll be differentiating yourselves from an average student who writes volumes and volumes of text. Unless and until you start practicing from the beginning, you will not be able to achieve the desired objective and stand over and above the average student by your expression and also by presentation of the topic. Now, logical sequence is an effective tool for understanding. So you have these flow charts which will give the learning in a nutshell. This would be very useful when you are writing in the examination, because the examiner comes to know on hand without any difficulty that you are a know-how of the subject and you have understood the concepts very clearly. So try to prepare the flow charts, and then this will again help you to understand the concept in a logical sequence and also present it in such a fashion that you will be able to impress upon the examiner for getting this course. So now the competency based curriculum will not stop at compartmentalized approach to the topic. If you know something, you need to apply your knowledge, and it is not enough if you are willing to do it, we must do it. So knowing is not enough for in medical profession, because you need to apply what you have learned, and therefore you have these case scenario based questions. So you have the clinical notes, or your question paper contains the case scenarios, and there you are applying your basic knowledge to solve the problem or generate an answer. So it is a higher level of the cognitive domain, wherein you are analyzing the case scenario, applying your knowledge of basic sciences to evolve a treatment modality. It is application, analysis, application, and synthesis. So you go to a higher level of understanding or the cognitive domain in developing the ability to solve the problems. Now the question is, what gets measured gets done. So we say the assessment drives learning. If you go through the question papers, if you have already not gone through the question papers, it is high time you go through the question papers. And we have tried to give an extensive question bank at the end of each chapter. So it is not that you should start preparing for these questions at the end of the year or just before the test. It is ideal to start preparing as you go through the topics. Now, there are 3 or 4 categories of questions which are given: the long essay, the short essay, short answers, and of late they have introduced multiple choice. So, long essay looks at your ability to present the topic in a logical sequence. Probably in the next few sessions, I may talk to you about how to approach a long essay, short essay, and short answer. Now that we have constraint of time, I'll just introduce you to the types of questions and how you approach on a global scale. These long essays will test your ability to present the topic in a logical sequence, develop an argument to come to a conclusion. So we have these long questions. Maybe I'll take a specific question and then try to answer them or approach them in the later sessions. Now, this is an extensive opportunity for the student to look at the presentation of the concept in a logical sequence and then develop an argument and come to a conclusion. It gives you a lot of scope to present your answers in such a fashion that you are able to have or provide the evidence that you have comprehensive understanding. So in this, the block diagrams, the flow charts, and the diagrams become integral components. So that is the place where you score over the average student. Now, short essays are relatively specific, though it retains the same character as long essay. So short essay also, you develop the concept and then come to a conclusion at the end of the answer. Short answers are predominantly more specific ones, and they will test predominantly your ability to recall and also give the values or some applied aspects. So short essays and long essays give you an opportunity to present the answer in a logical sequence, draw valid conclusions based on your presentation. However, the short answers are more specific and they test your ability to be specific and to the point. This is how you score over in the regular formative and summative assessments. Now, the tool for future competition, majority of the competitive exams depend on multiple choice, and these multiple choice can be of different categories. Whatever example or the basic level multiple choice questions where you are able to answer these questions based on whatever you have acquired as knowledge and retained in your memory. Majority of these questions are recall type of questions. Now they have gone one step ahead and they have devised the multiple choice which involve analysis, application. Now these are higher levels of cognitive domain which requires specific training. So my suggestion to the students is to go through the multiple choice, try and figure out what is the right answer, and try also to understand or explain why the other options which are called as distractors are not the right answers. So if you do this exercise from the beginning, it will not warrant a specific training for your competitive exams, and it will help you to prepare then and there to face your competition in future. So day-to-day preparation aimed at reaching the goal is the essence of your preparation. I think I'm coming to the end of my session. I'll not be able to answer all the questions. I would appreciate that students and the participants of this webinar can put up their questions, and if possible, I'll take up these questions. Otherwise, I'll collate these questions and try to answer them in the next seminar. So, in brief, to summarize what we have talked about, goal setting, it is required to achieve the desired objective. It has to be specific, it should be measurable, it should be attainable, relevant to the individual and the context. It has to be time bound. Now, to achieve this, set the goal, make a concrete plan, start working towards the plan, ideally stick to the plan, and compare the deficiency, if at all, if there is any, with the plan and the output, and then make a midway correction if the plan is not doable. Otherwise, as far as possible, stick to the plan. But over a period of time, I'm sure you'll be able to make a realistic plan. Initially, when you make a plan, it will be very lofty and you may not be able to work towards the plan or stick to it. But definitely make a plan and then get to work, stick to it, and you'll be able to reach the goal and reach the desired objective without any fail. I think with this, I'll end my session. You please note down if you go through the textbook, we have given our email IDs in the preface, and you can also note my email ID. And you can write to me if you have any questions or if you have any suggestions of what are the things that you expect from us as authors to interact with you. I wish you a Merry Christmas and a Happy New Year. I hope to come back and meet you sometime during the first or second week of January, depending on your requirements. Otherwise, the next session where I propose to interact will be more towards subject-specific interaction in physiology, something of interest to you and me, with small tips for practical applications. I think I end my session here. I appreciate the participants for their patient hearing, and please write your suggestions on the email, which we'll take up seriously and get back to you during the first or second week of January. Thank you very much.
Venkatesh, I think it was a very informative session. We do have some of the questions from some of you of our audiences. Like,
Okay.
for example, if I just start with the question number one, which is, they want to know about the 2024 curriculum. What is new in this curriculum actually?
Okay. So, the competency-based curriculum is the major difference in the present curriculum with the past. Earlier, it used to be theory information and practicals and theory did not align with each other. To give you a simple example, when I started suturing a wound, I had completed my MBBS and I was an intern when I actually started suturing the wound. And of course, it was by trial and error method. And I had good set of people who were training me and they used to give me an opportunity to learn. Now you're testing your skills to suture on a live patient. Now a live patient you can go wrong or you may do it wrongly and you are jeopardizing the interest of the patient. Now if you compare the present competency-based curriculum, you would be given an opportunity to practice suturing on a mannequin. on a dummy, you will be practicing it, and somebody will be observing it. And after that, you start doing on your own, and then you go on to a live patient. So if you have to give an intramuscular injection or you want to give an intravenous injection, if you are testing it or trying it on a patient, you can get into a lot of litigations, putting the patient into a great risk. But in present situation, you are practicing all these skills. They have listed the skills which are to be acquired or mastered by a physician of primary contact, and you will get an opportunity to practice under supervision in a regulated environment, and you will also get an opportunity to practice on real-time patients under supervision, and later you will be certified to practice independently. So this is a major difference between the present curriculum and the curriculum of the past. The second point, probably you joined the session late. The second point is we were studying the different subjects independent of each other. We did not carry the learning or the message of one subject in complementing the understanding of the other subject. Like I did not take the lung functions to medicine to understand the abnormality in case of pneumonia. So this is vertical integration. I did not carry the information of appendicular anatomy to surgery to understand the appendicitis and the management of appendicitis. Now, there has been a conscious effort to integrate the various subjects and then give a comprehensive understanding of the subject so that you'll be able to have the basic sciences, the clinical science, and the paraclinical subjects coming together to give you a clear picture of the disease process. So this is the second one. Third one was the assessment. Your skills were assessed by listening to what you are explaining. Skill is to be assessed based on how you perform it. So the assessment was not connected, was not in line with the desired outcome to be measured. So the examiner was sitting in one corner. You would explain how you are going to give an injection without demonstrating how you are able to give the injection. Now they have the OSPI and OSCE which is being developed, where they will actually observe how you are going to perform the skill. So the assessment has aligned, or they are trying to align the assessment to measure the desired outcome. So they cannot assess your skills in Viva, and therefore there has been a radical change or a significant change in the present curriculum vis-a-vis the past. Any other questions?
Not as so far, sir. I think thank you so much, Dr. Venkatesh, for this session. I think it's the first session that we have had, on this topic. And I think, as you suggested to all the audiences, that we are going to have more sessions, on the medical course and goal settings. Also, we would like to add that we also would like to have some sessions on how to pass an examination. That are also one of the topics that we have been frequently asked by the student, that the key to pass examination. Definitely, the knowledge is definitely there, knowledge, learning, testing, everything. But I think, as a professor, as a educator, I think you should guide students that what is the key, what are the challenges they may face, and how can they overcome the challenge and they face during the examinations.
No, my intention is take up the subject specific discussion with some tips during the session. So each
Sure.
session can have one tip which can be used by the students, and it will also give them an opportunity to understand the applied aspects of basic sciences like physiology how it can be applied to treating the disease or understanding the cause of the disease, more inclined towards clinical practice or applications. We can plan that session depending on their inputs. You can share my email ID or you can give one common email ID whenever you are sharing the information so that they can write to us, and based on their specific requirement we'll try to meet the requirements as and when we find time.
Sure, sir. Thank you so much, sir. Thank
It was my pleasure. Thanks for all the participants. We'll see you sometime during the next year, early part of next year. Thank you very much.
Thank you, sir. Good evening, sir. Thanks to all the participants also for joining the session.